More people will get access to the COVID vaccines next week, so we know more of you have questions about how they work. And to answer some of the most common ones is Dr. Helen Boucher, Chief of Geographic Medicine and Infectious Diseases at Tufts Medical Center. Good to see you.
Great to see you, Emily.
All right, first things first. Are these vaccines safe?
Well, Emily, the good news is that not only are these vaccines 95% effective in preventing COVID disease, but all the experience so far from the trials and from our experience now with millions of people actually are that the side effects are mild and really it's quite well tolerated and safe.
Is one vaccine better or more effective than another?
Well, of the two we have now, they're both using the mRNA technology, and they both, amazingly, are the same 95% effective in preventing COVID disease in people, and that includes severe COVID, and that includes older people.
What about if you have another medical condition? We talk about these comorbidities, diabetes, cancer, heart issues. Is it still safe then?
Yes, and it's even more important to be vaccinated if you have those underlying conditions, because we know that you're at greater risk of doing poorly with COVID. Indeed, those patients were included in the trial, so we know that the vaccine is both effective and safe in those people.
Along those same lines, if they're taking other medications, maybe blood thinners, immunosuppressive drugs, still safe then?
Well, certainly for blood thinners.
Okay.
Immunosuppressive drugs were included to some degree in the clinical trials, and the concern would be that patients with a suppressed immune system might not respond as effectively as well to the vaccine. So in those individuals, we certainly want them to be offered the vaccine, but it's even more important to follow those mitigation measures of wearing a mask, washing your hands, watching your distance, avoiding crowds, and staying home when you're ill.
What about, could a vaccine trigger a positive result on a COVID test? I mean, these vaccines are not going to give you COVID-19.
That's correct. So both of these vaccines are what we call inactivated. They do not contain any virus, so they do not cause a positive test.
This is a question that has spread really quickly on social media. I've seen it a couple times. Can these vaccines cause infertility in women?
Yeah, so Emily, unfortunately, that is part of what's been a disinformation campaign. There is no evidence that these vaccines have any impact on fertility.
You've had both doses of this. Is there anything you feel more comfortable doing now that you couldn't before?
It's a really good question, and I'll be totally honest with you. I feel more comfortable going to the grocery store. Yeah. I feel more comfortable being a little more, doing activities that I just wasn't doing.
Right.
Certainly, I still wear a mask. I still maintain my distance, but knowing that I have a 95% chance of being protected is a very good feeling.
Yeah, absolutely. And thank you so much for the answers to all of these questions. We know we're going to be checking in with you more as the weeks continue. Dr. Boucher, thank you.
Thank you, Emily.